And you are sending in a lot of questions right now about testing and coronavirus. We are back with a Cone Health expert answering all of your questions about COVID-19, not just testing. You can keep sending them to us at the number on your screen at 336-379-5775. Okay, this was a really interesting question, I thought. One person said they've taken two tests, a PCR test and a rapid test. One was negative, one was positive. Which one would you believe?
I think it would depend a lot on whether they had symptoms or exposure and what the timing of the tests was. Does it say which one was positive?
It does not, but which one's generally more accurate?
That's an excellent question. So PCR tests are extremely sensitive, and they will pick up matter from previous infections for as long as 90 days after you've been infected. So they're not necessarily great for telling us if you're an infectious threat. They can tell us if you've been around COVID and had substantial numbers of germ in your system in the last 90 days, but that doesn't really help us know if you are infectious right now. Now, the antigen tests are slightly less sensitive and also designed to be most effective picking up germ when you're pretty contagious. So they're most effective when you're producing a lot of germs, such as when you're in the middle of an active infection. So I would have to say that it really depends a little bit on what your personal situation was, which test you might take more credibly, and knowing that you could see both early on. You could see a negative one of either test early on in an infection or late in an infection.
But say if you need clearance to go back to work, it's the rapid test that might be better for you because it shows if you have enough virus to spread it.
Correct.
Okay, great. Another person wants to know, why don't we use saliva? Why do we have to stick that thing in our nose?
That's a really great question, and a lot of people are kind of squicked out about having to stick a swab in their noses, and I get that. Our tests were just engineered to detect germ in nose, and so they're not particularly targeted at salivary detection of germ. So I wouldn't try to. I've been reading about people YouTubing about how to convert their nasal test to a throat swab, and I just
seems like a lot of trouble.
There may be future generations of tests. We may, over time, as the germ is with us and we evolve with it, our tests may move to a predominantly salivary test. And at this time, we just don't really have the data to support doing that.
How hard is it to find a test right now?
Boy, it depends. There are a lot of tests around. I think a lot of it is how quickly can you get one on the timetable that you want. So Cone has expanded its testing by 4 or 5-fold. There's a great big mass testing site at the Coliseum. Doctors' offices are offering tests now. Pharmacies have ramped up. So I think it's not that hard to find a test. The hassle factor may still be there as far as having to make an appointment, having to get yourself there, having to get it done, and maybe not quite on the time frame, right? I had time at 10 o'clock and they've got an appointment at 5. And or maybe not at the location that I want. So I think there is some hassle factor. I think the tests are out there. Also, Amazon is well stocked with home tests, and I think that the government website went live today, covidtest.gov, where people can actually order their own home tests. Now, I have not had feedback. I've talked to several people who have actually placed an order for tests. I do not know what the time window for having those delivered is, so I think that might be a little bit of a future, right? I have these for the future as opposed to having it for use right now.
So speaking of timeline, if you get COVID, when should you actually seek treatment? When is that important?
Boy, that's a great question. So if you have a lot of health trouble, particularly if you have advanced heart or lung disease, you probably want to talk to your provider about whether you fall into a risk category where treatment might be beneficial. There is a limited number of treatments available to try and help keep very high risk people out of the hospital and from from dying of COVID. And so there are a small number of these treatments for the rest of us. Really, what would make a difference is if you're having trouble breathing, if you're having trouble with bothersome symptoms like nausea or are having trouble eating, having trouble getting around, then these are all things that you would want to consult with your provider about. I think as far as going to the emergency room because of possible COVID, we're really talking about things like I can't get my breath, I'm not strong enough to walk to the bathroom by myself, I have a fever that's been going on for several days, and I want really might want to be sure that there's not something else going on. So I think the usual markers of infection, but for most of us, this will just pass, and we just need to rest and
So
fluids.
if someone in your household tested positive, but you initially tested negative, how long should you wait before testing again?
I think about 48 hours. I think that would be, if somehow you've avoided it in the household, I think I would retest it about 2 days.
And if that comes back negative too, are you good to go?
I still would be a little cautious. Frankly, I would be really careful about wearing a mask, and I would limit my trips out of the house to those that absolutely had to be, right, absolutely necessary. And I think that you just need to continue to, if you're living with somebody with COVID, you have to just really have that extra grain of salt, take that result just a little bit cautiously.
Well, speaking of wearing a mask, we're getting lots of questions about what is the best type of mask. We're going to answer those on the other side of this break, and keep sending in your questions too. It's 336-379-5775.